Welcome to our Cardiology series. This video is on cardiogenic shock. Cardiogenic shock is defined as a state where the cardiac function is insufficient to perfuse the tissues. Hypoperfusion can lead to organ dysfunction and death. Characteristics include sustained systemic hypotension, pulmonary capillary wedge pressure greater than 18 mm mercury, and cardiac index smaller than 2.2 liter per minute per square meter. Epidemiology. The incidence of cardiogenic shock increases and it occurs in 8 to 9% of STEMI patients, as well as about 2.5% of non-STEMI patients. Risk factors for mechanical complications after STEMI include female gender, old age, and late or no reperfusion in infarcted territory. Etiology. In 75 to 80% of cases, it occurs due to severe left ventricular systolic dysfunction, but it may also occur in right ventricular infarction, mechanical complications from ventricular septal rupture, acute mitral regurgitation, free wall rupture leading to tamponade, systemic inflammatory response syndrome, infection, bowel ischemia, and iatrogenic causes. Signs and symptoms. Please note, only about 25% of patients who develop cardiogenic shock are in shock at presentation in the hospital. Possible signs and symptoms include dyspnea, rales, elevated jugular venous pressure, altered mental status, narrow pulse pressure, reduced urine output, cool, clammy skin, and elevated lactate levels. Hemodynamic criteria include a systolic blood pressure of less than 90 mm mercury or reduction of 30 mm mercury from the patient's baseline for more than 1 hour, and that the patient is not responsive to fluid administration alone, or the cardiogenic shock occurs secondary to cardiac dysfunction, or either of the following. It is associated with signs of hyperperfusion, there is a reduced cardiac index, or there is an adequate filling pressure, that is, a pulmonary capillary wedge pressure greater than 18 mm mercury. Other sources use 15 mm mercury as the value. Differential diagnoses include aortic dissection, which leads to a widened mediastinum on chest X-ray, myocardial infarction, arrhythmias, pericardial effusion or tamponade, chest trauma, valvular heart disease, myocarditis, chronic heart failure, end stage, and cardiomyopathy. Diagnosis. The diagnosis is usually clinical, based on hypotension, oliguria, clotted sensorium, and cool and mottled extremities. Hemodynamic criteria, as previously mentioned, are also important for this diagnosis. Additionally, myocardial dysfunction may be detected, and hypovolemia, hypoxemia, and acidosis should be excluded. An early echocardiogram is recommended. An ECG may detect myocardial infarct, and a chest X-ray can exclude pulmonary edema and other differential diagnoses. The laboratory analysis should include a complete blood count, electrolytes, cardiac biomarkers, and arterial blood gases. Treatment. Stabilization should be achieved to prevent end-stage organ damage. Here, an adequate mean arterial blood pressure should be maintained with intra-arterial pressure monitoring. To achieve this, norepinephrine, dopamine, and dobutamine may be used. Hemodynamic monitoring with Schwann-Ganz catheter guides the fluid management. Mechanical circulation support and mechanical ventilation should be provided as needed. Hemodynamically significant arrhythmia should be managed, and fibrinolysis is used in STEMI if there is a delay to percutaneous coronary intervention greater than 2 hours. An emergency coronary angiography and revascularization, often as a percutaneous intervention or coronary artery bypass grafting, may also be used. Prognosis. Cardiogenic shock is the most common cause of death in acute myocardial infarction. It has an in-hospital mortality of almost 50% and higher in patients older than 75 years of age. The prognosis is very poor in end-stage non-ischemic heart failure if no heart transplantation or long-term mechanical support is initiated. The average 1-year survival after early revascularization is between 50 and 55%. The survivor's quality of life is usually excellent, and 83% are asymptomatic or have mild symptomatic heart failure. This video was part of our cardiology series, and it was on cardiogenic shock.